All right, thanks, Rick. Well, this week is EMS week, and that stands for Emergency Medical Services. But what is that, and what does it mean for our community? So to answer those questions, we are joined by Chris Shandera with St. Luke's EMS. First of all, Chris, thank you so much for joining us here today.
Yeah, thanks for having me.
Yeah, so what is EMS week for folks who might not be familiar?
Sure, and there are probably a lot of people who aren't familiar. EMS week was established in 1974 by President Ford. It's just a week for us to recognize and appreciate the EMS professionals who are out there 24 hours a day delivering emergency care.
I think a lot of us, when we think of EMS week, we might think of just ambulances, right? But it's so much more than that.
That is the traditional thing that people think about, is when you pick up the phone and call 911, the ambulance that shows up to take you to the hospital. At St. Luke's EMS, there's a wide range of EMS that we provide in the form of being transported in a helicopter or an airplane, our ground ambulances from around different parts of the state, or some advancements we're making in the community health EMS realm, which is a paramedic who could come to your home in a non-emergency setting and help you walk through some health care.
And I imagine there's a lot of training that goes into this. Can you talk a little bit about that and what kind of specific training you guys get?
Sure, absolutely. There's a variety of levels of EMS professional, from EMT to paramedic and nurse, so those different credentials require different levels of training. For a paramedic, which is kind of considered the most advanced level of training for someone who's pre-hospital, it's an associate's degree program offered through a university, most commonly courses in anatomy and physiology, cardiology, and pharmacology.
I imagine there's no typical day when it comes to your line of work, but what are some of the most common calls or calls you encounter?
Sure, well, as we're approaching or entering the 100 deadliest days of summer, certainly we see a huge increase in automobile accidents over this time frame. But folks who are just minding their own business hiking and get stung by a bee and have an anaphylactic reaction would be someone we would likely encounter during these summer months as well.
What do you want folks to know about EMS work in particular?
I think it's great for people to know that there are dedicated professionals waiting around the clock to respond to any emergency, and that the job for them takes a big toll, both physically, mentally, and emotionally. And if you see an EMS professional out there, try to take the opportunity to thank them.
Now, EMS is not an essential service in Idaho, but why do you believe it should be?
Yeah, you're right. So I think EMS should be an essential service, and what that means is it should be funded to the level of law enforcement services to make sure that it exists for everybody across our state. As you enter rural Idaho, there are certainly some areas where you may have a significant delayed response to get an ambulance to your emergency. And I think probably like you, that's not what you would want in that situation.
Yeah, you often hear about that on the news, right? That these communities might not have that accessibility when it comes to emergencies sometimes. So definitely something you probably encounter often.
Yeah, we definitely see it, like I said, most commonly in rural Idaho. There's a great group of volunteers out there who are part of their community that deliver that care, but those numbers we've seen dwindle year over year, so we want to make sure that the service is there when somebody needs it.
All right, Chris Shandera with EMS, thank you so much for joining us here on the News at 4.
Thanks for having me.
All right, we'll be right back.